My name is Aishath Muneer and my colleague Fatma. We together did a small survey on junk food types and its salt level. We both are studying Masters of Public Health and Maldives National University. We both are also working in health sector in Maldives government. This is a small overview of the location we conduct our study. This is the Maldives chart. We are located in the middle of the Maldives. Here is the location we conduct the study. It's called Kudavadu, the island we are staying. So I'll go on with the introduction. Junk foods are processed foods which are unhealthy. Most commonly used junk food include fast food, biscuits, chips, candy, gum, sweet, desserts, as well as fizzy drinks. This food type consists of salt, sugar, fat, and are high in calories. Usually junk foods are low in nutrients and high in fats. We consider our survey on that label salt and sodium both we have included in our survey is a salt. We have mentioned that it's the salt level in our survey. High amount of salt intake increase blood pressure, increase the risk of getting heart failure, and also increase the risk of renal diseases. Consumption of unsalty junk foods regularly increases the amount of salt intake. When people consume excess amount of junk food and excess amount of salt intake results, which is undesirable for our healthy life. It's a limitation for us that there is no any relevant study that is carried out in Maldives. No study about junk foods. The aim of our study is to identify the salt level in junk food products in Maldives by using the information from the food labels. And here are some of the labels that we have taken. Some of the literature says sodium is an important nutrient required for plasma volume maintenance, acid-base equilibrium, nerve impulse propagation, and normal cell activity. The key contributors to the intake of dietary sodium rely on population's cultural background and dietary patterns. Reducing salt consumption has been described as one of the most cost-effective steps that can be adopted by countries to enhance health conditions for the population. For an expense that falls below the average annual incomes of gross domestic products per person, mental mitigation in inactivates would produce an extra year of healthier life. And here some of the literature says that problem associated with junk foods are high salt content, high fat content, and also high sugar content. Mm, High salt content on junk food contains high level of salt. For example, lots of salt already in food such as pizzas, breakfast cereals, and biscuits. So when people eat junk foods, too much salt is bad for the health. When they have more salt than they eat. High fat content intake of food containing high level of saturated fats can lead people becoming overweight and obese. That includes diseases such as determinant heart diseases. A sugar content, soft drinks, cookies, cakes, and lollipops also contains lots of sugar that can make them taste too sweet. However, consumption of high content of sugar may lead detrimental health problems such as rottens the teeth, harmful for blood, and introduce other diseases such as overweight and obesity, and also diabetes. And some of the literature says reason for popularity of junk foods, it includes the time factor, junk food addiction because of simplicity is too strong. They are tasty and very fast and very tasty to cook. Some junk foods do not require boiling or heating. The taste factor and the junk foods are so delicious, yet due to a desirable flavor become because of the flavor it produced due to lavish use of oils. Advertisements for junk foods. There is also concern about targeting children with advertisements because of kids. They are simple and likely targeting for junk foods. And also shelf life is of transport. Some researchers says there are reasons for avoiding junk food which may lead to low concentration, elevated cholesterol. Cholesterol frequently affects the liver where it is metabolized in addition to producing plaque and constricting arteries. Also heart disease. For nutrition value, the nutrition value of junk food is around 1, which is the scale of 1 to 10. And also it is strongly addictive, heavy chemical additives, loss of oxygen supply. As junk food is a high with fat, it's no they may build up of fat with bronchioles, which may result can take place. So the supply of the and decline of oxygen supply continue to decline in the body. These are the harmful effects which may lead to consumption of junk food. It says obesity, diabetes mellitus, hypertension, heart diseases, dental cavities, kidney diseases, neurological disorders, skin rashes, cancer, hypoxia, asthma, and behavioral issues. This is a descriptive survey in Maldives. The location is Dal Kodavadu. In 5 grocery shops. We conducted this survey. 1 minute sampling of 30 junk food samples were taken. Value of serve level were recorded from the selected labels. The survey was conducted in same as the Etal Kodavadu Maldives. It's a market survey that was conducted to evaluate the salt content in the junk food commonly used in the island called the Kodavadu. This survey is included in different types of randomly selected junk food available in shops. Also, some questions were asked to the salesmen regarding the amount of purchase. The products were categorized into 5 main categories, compared values of each group, means of each group. The 5 selected groups are chips, fast food, sugary food, biscuits, salty snacks, and cream and sauces. Compared to WHO recommendation amount of salt, WHO it says amount of salt intake per day is less than 500 grams for adults. The data were coded and entered using the statistical package SPSS version 22, and also it was summarized using mean, standard deviation, error deviation, and using one-way ANOVA test. Probability values less than 0.05 were considered as statistically significant. And these are the results of our survey. The highest amount of salt among 30 items was recorded in Mexicana tortillas. It was 2.6 grams salt per 100 gram. The lowest amount was cotton candy, which was on zero level, and it was the only zero level product that we have selected. Salt content of salt content of selected types of junk food products ranges from 0 to 2.6. The mean value of the salt among all products was 0.754 gram. And this is the selected items we have randomly selected in our survey. It shows that the level of salt in all products tested are within the recommended level of WHO. All are below below 5 gram. The two junk food products contain salt level of 2.6 and 2.6 and 2.1 is a Mexican of tortillas and double crunch peanuts. Also, salt ranges between 1 to 1.8 were found in lemon puff biscuits, Mummy instant noodles, curry flavor, Bruto pasta cup, Alpha mayonnaise, Levin's crust chips, and Pringles potato chips, smoky barbecue. The remaining junk foods, as you can see, it's below 1 gram. This table shows the comparison among studied categories. The highest salt content among 5 categories were found in fast food. That is 1.33 gram per 100 gram, and chips it was 0.99 gram per 100 gram. The second highest salt level was found in salty snacks and cream sauces, 0.74 gram and 0.71 gram respectively. The lowest salt content was found in sugary foods. It was 0.241. However, there was no significant differences between the categories junk foods. It was below 0.05. There was no statistical difference between the means determined by one-way ANOVA. Although the items which have the highest amount of sugar have lower salt level in the most of the items. For instance, cotton candy, which has the highest sugar and zero amount of salt, but did not reach the level of significance. By asking the salesman, we came to know that in the among the 5 shops, around 20 to 50 items were sold daily, indicating all categories of junk food studied have no significance between regarding the amount of salt. As I mentioned earlier, all the items are below the WHO recommended level. So eating junk foods is a trend in Maldives. All we know that, and it's most commonly used in children. And studies by some study found that the intake of junk food by school-age children calculated by the junk food intake measures in aggregate was lower in 2015 compared to 2010. As we know from the result, the fast food group has the highest level of salt, that is 1.329. Some researchers have mentioned that frequent fast food eating is also a concern, as these foods are usually high in kilojoules, saturated fats, sugar, and salt. And daily fast food consumption is associated with higher calorie intake and lower standard of nutrition. Junk food advertisements on TV has the power to facilitate unsafe eating habits within the whole population. Sometimes parents also reward the children with sweet snacks. Coming to the conclusion, sodium is an important nutrient requirement for plasma volume according to WHO. As it is required for plasma volume maintenance, acid-base equilibrium, now pulse propagation, and normal cell activity. Reducing salt consumption has been desired as one of the most cost-effective steps that can be adopted by countries to enhance health conditions for the population. As the amount of salt is less than WHO recommended level in the selected junk food, daily meals and intakes of junk food together makes the amount of salt more than the WHO recommended level. As I said earlier, there was no studied in Maldives to verify these measures. And the result says there was no statistically significant difference between the products categorized those level means. Here are some of the recommendations. It is a societal and individual responsibility to improve dietary habits. Government policies and intervention should be established conditions that allow communities to consume sufficient amount of safe and nutritious food, including low salt, that constitute a balanced diet. Also, to reduce the intake of junk food, steps such as making the population conscious of the risk factors of junk food should be introduced. In order to enable the population to eat at home, the population should be aware of the benefits of the nutritious food. And we can have actual analysis of the nutrition values to make sure that the labeled ones are having the same amount of salt level. Include about to increase sample size, more varieties from the different islands. Then recommended the need for the survey to check the consumption of the people. Uh, this study also can be the baseline study to have a guideline about the salt level in junk foods in Maldives. Other realistic local actions for minimizing the consumption of salt includes integrating salt elimination into the food handlers' preparation curriculum, introduction of bottle or shelf labeling indicating that certain products are rich in sodium, also providing individual attending health centers with tailored nutritional recommendations, advocating for persons to reduce the dose of foods rich in salt, educating children and supplying children with safe atmosphere such as they continue to follow those salt diets early. And here is the references I have used. Thank you.